tear, it falls and hits the ground. A tree, it falls without a sound. A bird, it calls and sends you home. A man, he sits in the cold all alone.
Hi, welcome to The Joy of Sunflowers. You're about to watch Carly, a postpartum nurse. She is with the fourth trimester foundations, and she is about to give you a little rundown of postpartum after pregnancy loss. Now, during that time, there are so many things that go on in your body, and she is a world of knowledge, so I hope you enjoy.
Hi, everyone. My name is Carly Fleming. I am a postpartum and a newborn nurse and a mom, and I am the co-founder of Fourth Trimester Foundations. I work alongside my business partner and dear friend and fellow mom and nurse. Her name is Megan. You might hear me refer to her a little bit throughout this because we built this together, our business, and it really isn't, it's, I guess, technically a business, but it's really just a passion project that we want to make more of a thing. So we can do this full time. So we teach postpartum preparation classes to moms and parents during pregnancy, and how to care for your body, and recovery. And we do one-on-one calls, and support in that way, either during pregnancy or postpartum. And one of our really big passions is supporting moms at stillbirth, infant loss. So just a little disclaimer here, I have to add this, everyone's favorite part. I am a postpartum and newborn nurse, but I am not your nurse. So anything I say here is general medical advice. It's nothing that's specific to you or your recovery or your healing. So please just take this as a guide and a place to start, and open the dialogue with your provider, your support system. And please do not take any of this as, Carly said this in the workshop, I won't call my provider then. Please keep in touch with them because they know you and your health history. I don't. It's not fair what happened to your baby and it's happening to you. But you are still postpartum. So whether your baby, was not born alive, or they were born alive for a very short period of time, and they passed away, it's still not okay, but you are still postpartum, and your body deserves the care and, respect, that I know your baby would want you to have for yourself. So I'm going to talk about two different sections here. One is just about all of the changes to expect postpartum to your body, and very, kind of quick. Not that it should be quick and abbreviated at all. But I know there might be a lot of this in discharge instructions. You've already heard it before. So we want to just kind of highlight it here. And we're going to also talk about lactation after loss. That is one of our biggest niche passion projects as well, because it recently had a dear friend, and she did not know what to do with her breast. She had twin girls at 36 weeks, and they weren't around. So it was her first baby. She wanted to do something with her breast and she didn't know what to do. So I put together a little packet in their honor, the twin girls' honor, to make this accessible. So moms know their options for what they can do with their breast milk. So postpartum body recovery, I'm reading off of my website. I am going to put this on the side here, so you'll probably see it. So medications you can have over the counter, to have handy or have someone run out to grab for you or do Target drive up, is ibuprofen. So ibuprofen is also Motrin and Advil. They're all the same drug. So ibuprofen, Motrin, Advil. You can take that every 6 hours for pain and swelling. That's not a drug you can take during pregnancy. So that's kind of a nice bonus to throw that in there for postpartum. And acetaminophen or Tylenol. You can take that every 6 hours as well in a 975 of 3 regular strength, or 1000 milligrams. That's 2 extra strength Tylenol every 6 hours. So You can take Motrin every 6 hours, Tylenol every 6 hours. So essentially you can take something every 3 hours. You can also take them at the same time. They actually, I think, sell it over the counter now, a Motrin and a Tylenol combo. So it is up to you with what you want to do. Some moms are also prescribed a narcotic. So you can take those at the same time as a narcotic. I wouldn't take all three at the same time. It might be kind of tough on your stomach. But you can take, like a narcotic medication that was prescribed to you by your provider, as well as a Motrin. If it's a Oxy, now I'm thinking about it though. If it's Percocet has Tylenol in it though. So just kind of be wary, make sure you ask. So you're going to have postpartum bleeding. That's called lochia. Your bleeding can last, vaginal bleeding, for up to 6 to 8 weeks. Sometimes it's as little as 3, sometimes it's as much as 10. In a vaginal birth or cesarean birth, the bleeding amounts will be about the same, depending on the length of your pregnancy. If it was on closer to 40-week mark, you'll have more bleeding than like a 28-week or 30 or 32-week pregnancy, because the dinner plate size wound, usually have a dinner plate. Sorry. I forgot to put it out for this. It is a dinner plate 8.5 inches in diameter for a term pregnancy, where the placenta is attached. So that is where the bleeding is coming from. So, in pregnancies, like the 30-week mark or so, it's definitely a smaller area, but you will still have a significant amount of bleeding. So allow your body to heal. If you had a dinner plate sized wound on the outside of your body, no one would ask you to do anything, or you wouldn't expect yourself to do anything. Your vaginal bleeding will go from a red color to a pink to a brown to a white, and then it will stop, but it can stop and start again. So don't think like you're on the downward trajectory. It might start again. So don't throw the pads away, or the Depends. Think of your bleeding as an indicator of your body's healing. If you see a lot of bleeding after more activity, that is your body encouraging you to slow down. So I'm going to separate it out here now for a vaginal birth, recovery for that. So regardless of the size, the length, or circumstances of the delivery, you need to heal. If you had some tearing, if there was an episiotomy, if there is some swelling or hemorrhoids, they can all cause discomfort. Sometimes it's all of those things. Sometimes you might even have hemorrhoids in your pregnancy. Sometimes you didn't though, and then they kind of come up with pushing or just very end of pregnancy. They do not feel good. There's some kind of a spray bottle, like a peri bottle is what it's called, that you should get from the hospital. You can ask for more, take it home, just with warm water, kind of spraying your perineum. So we don't eat really wiping quite yet to allow healing. Even if there wasn't really any tearing that happened, it's just still, a lot going on down there. So you want to give your perineum time to heal. Taking care of using some of the products that hopefully the place you had your baby gave to you, like a cooling spray or the witch hazel pads or like a preparation H type cream. Ask how to use those. And if you've been told and you don't understand, ask again. You should not have to Google anything in the hospital. That's what your staff, the nursing staff and your physicians and midwives are there for. So ask them. There's a sitz bath you can also use. They might have that at the hospital. You can even get it at like a Rite Aid or a Walgreens. Kind of sit and soak your bottom in for like a 5 to 10 minute mark. Sometimes there's different like salts and other creams you can use to put in the bath as well. But you won't be taking an actual submerged tub bath for, at least the 6-week mark. And the stitches, if you did have any, will fall out on their own in a couple of weeks in the toilet. They're usually like a blue string type thing, will fall out in the toilet. So you might not even notice. So for a cesarean birth, it is major abdominal surgery. So please, we need to remind everyone of this. There's a lot of layers involved, and it takes time. Any other major surgery like this, there would be months of physical therapy and healing, and no, not really here, which is very unfortunate. So keeping your incision dry and clean, and so it's able to come together well is it's most important. So there's going to be different things that are on your incision depending on your provider. Sometimes it's like surgical super glue that you can't even really see. Sometimes it's tape strips. Sometimes it's stitches, sometimes it's staples, sometimes it's all of the things. So if it's some type of, every provider is different. I'm not going to try to say what they'll do, but we encourage every mom to have a look at their incision before they go home from the hospital. It doesn't have to be you. If you're really uncomfortable, maybe just take a picture and put it on your phone somewhere. So you can kind of compare it. If you notice like, oh, was I having bleeding from there, or was I bruised there? Or like, you can have a starting point to know what to look at, or have a partner, a loved one that's there with you, get a really good look at it. So, you know, using a hair dryer on a cool setting is good to keep it dry before you put your underwear back on. Sometimes the mesh underwear can kind of like snag if you have like the tape strips or staples. So you can put a pad on it sideways if you'd like to. Basic soap and water during a shower is fine. You do not need any special soaps or creams or anything. Do not feel like you need to use that. A lot of providers will want to see you back in about 2 weeks in their office. And then around the 6 to 8 week mark. So if you notice anything before that 2 or 8 week mark, ask them. You do not have to suffer in terms of your own healing in silence, or you shouldn't suffer in any kind of silence. But that's easier said than done. Being in close contact with your provider is huge. So if you have any increased redness or drainage, if it feels warm or raised, or if you have a fever or anything feels concerning to you. Another good thing to do is splinting. So it's really like putting your hands or a pillow or something over your incision. So when you laugh, sneeze, cough, anything, it has support. So I've never seen a mom bust her incision open. So please try to limit that fear. But just being mindful of putting something there, or having a pillow nearby, or like a blanket or something. So hormone shifts. So we're coming back. So vaginal or cesarean birth, coming back here to bring it together. Hormones will rise and fall postpartum. It can take about 2 to 3 months to regulate. It can manifest as mood swings, hard time sleeping, irritability, but all of those things are grief as well. So it's hard to separate what is postpartum hormones and what is the grief of losing our baby. So just adding that on there for you. Hot flashes are very common, night sweats, lactation. So I'm going to talk about lactation in a little bit. So remember, lactation will occur whether you've latched your baby or not. Even if you know your baby is born very early, lactation can still occur. Sometimes it's around, I think, like the 20-week mark. 18 to 20 is really when the lactation process starts to initiate. So there's still some pregnancy symptoms that can be lingering as well. So swelling in like dependent edema is what it's called. So in your feet, especially, a lot of times it's in your face. It can be everywhere, even in your perineum. You can have a lot of swelling there. It take weeks to dissipate. Phantom kicks, that's a really tough one to kind of experience. Feeling like your little baby is kicking inside your belly, even though they're not here. It's hard to say what that is, the cause of that, but I know a lot of moms, whether a baby is living or not, do experience the phantom kicks. A lot of cramping. It almost can feel like mini contractions as your uterus is shrinking back down from its watermelon size, if it was a term pregnancy, to cantaloupe within a few minutes of birth, back to the pear size. So that's the contractions and cramping is what gets it back to that size. They usually lasts a few minutes at a time. So it's not going to be, for hours long. And using a warm compress, Motrin or Tylenol will help. And taking it easy. So no mom feels like they can rest, but your body needs time to heal physically and emotionally. Limit movement just to walking, and definitely no exercise or anything strenuous for around 6 weeks is ideal. But 6 weeks is literally a date on a calendar. It means nothing in terms of your recovery and your healing and where you're at all. So don't think 6 weeks means something magical will happen, because it won't. Do not lift anything heavier than 10 to 15 pounds. Don't lift anything at all if you can, to allow your body time to heal. If you're, doing something a little bit more strenuous, or lifting, or standing for a really long period of time, your bleeding will increase. So that's your body telling you, I need you to take a little bit easier. Pelvic rest for a minimum of 6 weeks is recommended. So, of course, intercourse, but we're not even going to get into that. Swimming, taking a bath, like a tub bath, or douching or anything like that is definitely not recommended at all for at least 6 weeks. But also included in that is squatting, doing lots of stairs, anything where your pelvis is really involved. But I guess, of course, included, like I mentioned briefly, is intercourse for 6 weeks is not okay. But I'm not going to talk about that too much, because 6 weeks is a very short period of time to feel like you would be ready to do something like that. So, and so I want to encourage you to be in touch with your provider as much as you feel like you can. I know it might be tough to kind of reach back out to them, because, you went to them in a much different headspace when your baby was having a heartbeat and living inside of you. So I know it might be tough to go back in person, or just even speaking to them about this. But you deserve to feel like you know how to care for your body. And like I mentioned before, I know your baby knows you deserve that as well. So asking them questions, not being afraid to like, oh, I think it's okay, I'll be fine. Like, you can call them, you can ask them all of these questions. You deserve a postpartum experience just like anyone else who has their baby with them. So please remember that, and please do not feel like you deserve anything less because your baby isn't there with you. You deserve more. So that is why we're here for. I'm going to get to lactation next. All right. So on the side here, you will see a little pamphlet, a brochure that I made along with two of my dear friends. Well, three, I guess. Megan, my business partner, and Jillian. She is the founder of a nonprofit in New Jersey called Courage and Time in honor of her son, Lorenzo. And another dear friend, Sophia. She is a lactation consultant, or an IBCLC, International Board Certified Lactation Consultant. We put this pamphlet together for moms, so you know what you can do with your breasts and your milk after an infant loss. You deserve to know what to do with your breasts. So your body starts making colostrum or milk around the 16 to 20 week mark. So this is most applicable to, around that 20-week mark for an infant loss or pregnancy loss and beyond. So the biggest takeaway is your milk will come in if it's around the, anything after 16 weeks and beyond, your milk will come in. So your body does not know if your baby is alive or not. The milk coming in process happens when the placenta is detached from the inside of your uterus, and those hormones have that cascade of milk coming in. So it's going to come in no matter what. For some people, it comes in very intensely and they have a lot of engorgement and fullness, and it's very uncomfortable. For other people, they barely notice it, and anything in between. So it'll kind of start around day 3 to 5 after birth and should subside around like 2 to 7 days postpartum. Your breast will, for engorgement, will probably typically feel hard with your skin being stretched with some veins. You might feel some warmth or tenderness, and this is what's expected. So you have two options with what you can do with your breasts and your milk. So you can stop lactation or keep it going. So lactation suppression, stopping milk. For whatever reason, you get to do what feels right for you and your family. So these are some tips we have here for suppressing lactation. So wearing a snug bra, but not like a very extra tight bra, like a snug bra with not no wire in it. Wearing breast pads and changing them often. If if there's milk that leaks onto them, you want to keep changing those. You can use disposable or washable. Minimize in the shower, warm water hitting your breasts. That can stimulate your breasts. Basically, you don't want to stimulate them. It's a supply and demand thing. So if you stimulate them, your body's going to think like, oh, I need to make more. So stop with the stimulating. You want to use some cold gel packs or a cold compress for any kind of swelling. You can use some types of teas. There's like a no more milk tea. There's peppermint or sage or jasmine tea. You can use any of those. Some people do, this is kind of like an off market thing, use Mucinex DM or some kind of decongestant for that as well, or like a Benadryl, something like that. Using Motrin or Tylenol for swelling and discomfort. Only hand expressing if your breasts feel very firm, like your forehead, then handing expressing for comfort. Like your breasts as soft feel like your nose, but if they feel really firm, like your forehead, that is when you can hand express just for a little bit for comfort to like take the edge off. You can use some cabbage leaves that's kind of cold in the fridge. You can kind of crack them to get the properties of it out, rinse them and store them back in the fridge or in your bra. But once they're wilted, you want to throw them away. It doesn't smell the greatest, but it works. So how long will it take for the milk to go away? Sometimes it's a few days. But if you've really had a established milk supply and have been pumping and doing all the things, it might take a little bit longer. Some moms even feel a letdown, that tingling sensation, like up to months after. So even up to 30 days after the last time your body made milk, that is the end of weaning, is at the 30-day mark. So it doesn't happen as soon as you don't see milk. So if you do have an established milk supply, steps you can take, continue to pump. So let's say you're pumping 8 times a day in a 24-hour period, drop it down to 7 and then drop it down to 6. You can kind of stretch the time frame in between them, kind of keep it on a similar schedule though. Weaning can bring up a lot of emotions because your hormones are shifting and you're also experiencing the grief of losing your baby. So it's hard to differentiate between what's weaning and what's grief. So just kind of putting that out there. Clogged ducts is a big thing that kind of comes up, and mastitis. So clogged duct or a plugged duct is something you want to take care of, but when it gets really infected or out of hand or inflamed is when it gets to mastitis. Sorry, I didn't mean to say infected. Really inflamed, that's called mastitis. So clogged duct will be a hard, painful lump that you can feel. Sometimes there's redness or warmth, but sometimes you don't even feel the lump. So keeping it really simple for you guys. Sometimes you feel it, sometimes you don't. A mastitis is when it's actually it's so swollen that it really can lead to infection. The symptoms of a clogged duct, but along with flu-like symptoms. So fever, aches, chills, all of those things. First, you want to call your OB or your midwife if you notice any of these flu-like symptoms or any increased redness or like streaks coming up your breast or, fever or anything like that. Or if you don't feel better in a couple of days, if it's a clogged duct, let them know. Sometimes they'll say, give you an oral antibiotic. Other times it's not indicated. For managing the symptoms of clogged duct or mastitis, really, a warm compress prior to expressing milk, if that's what you're still doing, expressing every few hours until they've softened while you're massaging them, like lightly, not really intense, kind of like light touch. And once the clog or mastitis passes, you can go back to reducing your milk supply or continuing to express. So the other option, if you're not going to stop lactation at the time, is sustained expression. So continuing to make milk. Some moms don't want to stop the milk production. The actual act of expressing milk can feel like it's helping you heal emotionally or physically, making you feel like you're doing something in a time where you feel so helpless. And so breast milk donation is a big option. So there's formal donations can be made in milk banks. for premature babies or babies in the NICU. The Milk Bank Association of North America has really good resources on their website for moms who experience a loss. So that's a good place to go, where hopefully there'll be minimal amount of times where you'll feel triggered by pictures of moms feeding their babies. You can do some informal milk donations or private groups, such as Human Milk for Human Babies or Eats on Feets. Some moms also would consider just kind of donating to a mom that they know is having breastfeeding difficulties, or wants to provide for breast milk for their babies. So you can do the donation route, or can also use some memory making with breast milk, using some kind of jewelry like earrings, necklaces. It doesn't have to be done right away. You can have the milk like up to, I think it's like 1, maybe 2 ounces frozen in a bag for years in the freezer. You can still use it. So it doesn't have to be something you do right away. Combine it with other items, keepsake items as well. And that is most of our lactation support. Again, peek at this flyer, peek at our resources that we use on there. There is this QR code as well. You can use some more topics that we kind of go into more detail about what we talked about in our flyer. I think I actually might have it here on the website. So let me look. I think it's just kind of more links. Yeah, it's just including more links, an actual video on hand expression, how to differentiate between a plug duct and mastitis, a link to that tea I talked about, some good memory making with breast milk. Some of them are moms who've experienced infant loss as well, and more informal milk donation. So there are a lot of resources out there. So thank you for joining me, chatting about your body and healing and recovery after birth. I know this is not something you expected or would wish on anyone. But we want you to know that you and your recovery and your healing matters just as much as anyone else. So please don't minimize what you're feeling physically and emotionally and everything. And you get to talk to your provider and your support just as much as anyone else who has a living baby. So thank you for listening. I'm Carly, postpartum and newborn nurse with 4th Trimester Foundations. You can find me online. The easiest way is on Instagram. We have all the links from there. So we're at 4th, so FOURTHTRI, like trimester, 4th Tri Foundations with an S. You'll find us there. We do a lot of stuff. So thank you again for listening. And we would love to chat with you one-on-one. We do the one-on-one calls. So we'd love to chat with you there. If you have more questions, we could chat with you and your partner, any other support people. So we can help you feel like you. So thank you again, guys.
Please note that all speakers, including experts and professionals, express information, views, and opinions that should not be used to diagnose, treat, cure, or prevent any medical conditions. If you have a medical issue, please consult a qualified professional. Speakers voice their own views, opinions, and conclusions, and they may not reflect the views, opinions, and conclusions of other speakers. Ella Rose, The Joy of Sunflowers, and its sponsors may not endorse all or any of the views, opinions, or conclusions expressed.
And I